As we saw from the fire triangle earlier, oxygen is a vital ingredient of any fire. Without oxygen, fires will not burn. As we all know, we are surrounded by oxygen in the atmosphere in sufficient quantities to support combustion. However, in healthcare premises, additional oxygen or a nitrous oxide and oxygen mixture is also readily available either from cylinders or piped oxygen supplies. If this additional oxygen is added to a fire, it causes it to burn more intensely and therefore helps the fire to spread. In fact, a higher level of oxygen in the atmosphere can cause some materials not normally considered to be combustible to ignite and burn vigorously. It has been shown that fires in oxygen-enriched atmospheres may cause fire compartments to fail sooner, therefore reducing the evacuation time available. Okay, so mixing oxygen or nitrous oxide with fire is dangerous. But in hospitals, oxygen is also vital to the treatment of some patients, so what can we do? It really depends upon the circumstances, as for example, leaving patients on oxygen may reduce or prevent smoke inhalation. Let's say there is a fire in a ward kitchen, and the fire isn't likely to involve the oxygen supply. In this case, it is usually better to leave the patient on the supply until they are evacuated, or the fire is extinguished and any smoke is removed. If, however, the patients are threatened by fire, then with the agreement of clinical staff, they should be switched to a suitable portable oxygen supply and evacuated when possible. Let's now look at the dangerous situation where fire may spread to or is already involving an oxygen supply. This could be, for example, a fire on a bed with a free flow of oxygen feeding it, or a fire that is spreading to an open oxygen valve. In this situation, the recommendation is that the oxygen supply should be isolated as soon as possible. But this must be a clinical decision based upon what other patients are connected to the oxygen supply and their needs. Isolation should then only be performed by or supervised by clinical staff, as maintenance, security, or fire officers would not be expected to be familiar with patients' clinical requirements. If a clinical decision is made to isolate the oxygen supply, this should be performed initially, if possible, at the cylinder or bed head, and then at the main supply to the ward. In newer or refurbished wards, the main supply will normally be at the entrance to the ward, or sometimes at the nurse's station, and valves should be marked with the area they isolate. Staff must be familiar with valve location and understand how the locations are displayed. To limit risk, medical gas cylinders should always be turned off when not in use. They should be stored in a dedicated position within a ward and be adequately identified with signs. If oxygen cylinders are located near a fire, the cylinders should be turned off if it is safe to do so. Any fire that involves an oxygen cylinder will require immediate evacuation of those within the area where the cylinder is located. Don't stop to attempt to fight the fire. People evacuated must be moved as far away as is practical, as fires can cause cylinders to explode violently and fragments might fly in any direction. Any cylinders that have been involved in a fire must not be moved. The fire service have operational procedures that will safely deal with damaged cylinders and gas bottles. On arrival, the fire service will assist in decision-making about oxygen or gas isolation, but they will not isolate any supplies unless it can be confirmed that it is clinically safe to do so. Following any incident in which oxygen supplies have been isolated, the maintenance team will need to check the supply integrity before any further supplies can be made available to patients. Before we finish this module, let's look at the recommended procedure for piped gas isolation. Remember, the senior member of the clinical staff should carry out or authorize this procedure. Identify the gas supply affected. Ensure that patients are placed on alternative supplies where required. Locate the relevant AVSU. That's the Area Valve Service Unit. This will normally be located adjacent to the ward or department entrance and will indicate the type of gas affected and the area served. To access the valve, you will need to break the glass, pull out a plastic shield, or depress a slide mechanism. You need to know how your particular AVSU operates. After accessing the valve, turn the handle 90 degrees to the closed or off position. The maintenance team should be informed as soon as possible so that supplies can be reinstated once an incident is over.